Welcome back. As flu season ramps up, we have some tips for staying healthy and keeping that bug away. Dr. Amanda O'Connor with UnityPoint Health, St. Luke's, joins us this morning. Thank you for being here. So talk about flu so far this year. I mean, are we entering, is this peak flu season? Is this just the start of it? What are we in right now?
Yeah, so really we're just seeing the start of the season. Peak is usually more around January time after the holidays and everybody's around together. It really starts picking up then.
That's when you start seeing people getting sick after all those holiday parties and everything.
We have seen a couple cases so far this year, about 8. So again, it is starting to pick up.
And then talk about the vaccine. I know there's people out there who are still wondering about, do I get vaccinated? Do I not get vaccinated? What does the vaccine cover? Because I know the past couple of years it's been kind of tricky where the vaccine maybe hasn't been so good at taking care of it.
Sure. So it's always kind of a guessing game. You know, the vaccine is based off of flu strains that were common last year. So they do their best to try to cover the most popular strains.
Yeah.
So again, everybody should get vaccinated, especially those people at high risk, those kids less than 6 months old, the elderly, and those with other comorbidities, you know, heart disease, lung disease, should definitely get the vaccine. And there is absolutely still time. I recommend everybody get out there and get your vaccine.
Now talk about flu symptoms a little bit, because when you talk about the flu, some people use it as sort of a broader term to talk about just being really sick. Right. This isn't talking about stomach flu, though. This is the respiratory flu. Is that right?
Exactly. Okay. So flu is a virus. You're right. It affects the respiratory tract, so the nose, the mouth. Symptoms are body aches, you know, fevers, headaches. The younger kids, those less than 2, tend to get some of the GI symptoms that really doesn't happen in adults as much. But again, you look for those shortness of breath, the cough, things like that. Yeah. You know, most people, if you're young and healthy, can be managed at home. Try to stay home, push your fluids, your Tylenol, ibuprofen. If you're those younger kids, those are people who should be seen by a physician, as well as the elderly or other comorbidities.
Sure. So, I mean, don't hesitate to take a kid or an older person to the doctor.
Any problems breathing, anything like that, those people should be seen.
Yeah. Talk a little bit about the myths real quick here before we run out of time. I mean, I know that, is it ever too late to get a flu shot in the season?
I would say it's better just to get it. It takes about 2 weeks to kick in, you know, before it's effective. But again, I would say get it. The chances of it decreasing your severity of the illness or actually getting the illness, that stuff, you know, is pretty good. So I would get it. The fact or the myth out there that I'll get the flu from the flu shot is a myth.
I was just going to bring that up because you hear that sometimes.
You will not get the flu from getting a flu shot. Again, there's colds out there and other strains, but you will not get the flu from
Will you get a little bit of a fever after getting the flu shot sometimes?
I mean, that's how your body's building its immunity up to getting it. So it's fighting, it's building up that immunity so you don't get the flu.
Got it. All right. Well, Dr. O'Connor, thank you for joining us this morning. Good tips on staying healthy through flu season there.